long time no see. This is YouTube Medical University. Learn by listening for just 10 minutes a day. Pain in your left shoulder, toothache, waking up several times at night to go to the bathroom. These could all be signs that your heart is about to stop. Please listen carefully. The 5-year survival rate for heart failure is about 50%. This is comparable to the survival rate for cancer. It's especially troubling that early symptoms are hard to identify and often not linked to the heart. Shoulder pain may seem orthopedic, a cough may lead you to a pulmonologist, and nighttime urination to a urologist. People usually suspect non-cardiac causes. That's why it's often not detected until it's too late. In today's lesson, I will introduce 7 SOS signs your body sends out from your heart, especially the number 1 sign. You can check this in just 10 seconds in front of your mirror at home. Just knowing this could save your life, so please make sure to watch until the end. Here's today's agenda. In the first segment, I'll talk about the shocking fact that just having shoulder pain can be life-threatening. It's an unexpected sign of a heart attack. And in the second segment, I'll rank 7 unexpected signs. Then, in the third segment, I'll tell you about self-check methods you can start using today and the signs that mean you should go to the hospital right away. First, in the first segment, I'll talk about myocardial infarction, which is when the blood vessels in the heart get blocked. I'll share a story that actually happened in my clinic. It's a man in his 50s. Doctor, my left shoulder has been hurting for the past few months. I visited the orthopedic clinic 3 times, but after MRI and x-rays showed nothing, they diagnosed frozen shoulder and advised pain relief patches and waiting to see what happens. However, when he happened to have an EKG during a health checkup, an abnormality was found, and that's why he came to my outpatient clinic. And after a thorough examination, it turned out that the blood vessels in his heart were starting to get blocked. The pain in his left shoulder was actually an SOS signal from his heart. When you move a little and your heart needs more blood flow because the blood vessels in the heart are narrowed, a signal from the heart somehow causes pain in the left shoulder. This is what's known as angina pectoris, a condition just before a heart attack. Why does the shoulder hurt? This is very important. Medically, this is called referred pain. The mechanism is honestly complicated, so let me explain it with an example. The pain signals from the heart, and actually the pain signals from the left shoulder, merge along the way and travel through the same pathway, so the brain recognizes them as coming from the same place. So the brain can get confused, huh? I just received a pain signal, but is this from the heart or from the shoulder? That's why the brain mistakenly interprets the heart's pain as coming from the shoulder, and you end up feeling it as shoulder pain. This is the mechanism that's thought to be at work. And this referred pain doesn't just happen in the left shoulder. Some people feel it in their left arm, while others feel it as jaw pain or tooth pain. There are also people who describe it as back pain or pain in the pit of the stomach. That's how much a heart attack can actually present as pain in various confusing areas. There are actually patients who went to the dentist because of tooth pain, but were told their teeth were fine. When you think of a heart attack, you might imagine sudden chest pain, but please remember that there are heart attacks that don't present that way. One way to distinguish between orthopedic pain and heart pain is that if it's orthopedic, meaning a problem with the shoulder joint, muscles, or bones, it hurts when you move it. However, if the pain is coming from the heart, symptoms tend to appear when the heart is under stress, so it's common for the pain to occur when you move or exert yourself. Just knowing this difference could save your life or the life of a loved one beside you. Now let's get to the main topic. A heart attack is an acute event, but in most cases, heart failure progresses gradually. It can advance without you noticing, and by the time you realize it, the stage has already progressed. In the second part, I will introduce 7 unexpected SOS signals from the heart that heart failure sends out, ranked for you. Number 1 is really unexpected. Please be sure to listen. Here at YouTube Yilao, as a practicing physician who diagnoses and treats heart disease, I share easy to understand data-based information that can help you become healthier starting tomorrow. It's important to have at least one reliable source of information. Before you forget which channel it is, subscribing to the channel would really encourage me. Also, I'm offering a free PDF that condenses today's lesson into a single 1-page handout. It summarizes the 7 signs of heart failure and simple ways to check for them. If you're interested, please register for the official line from the description and type Shinzu in hiragana using 4 characters. Now, let's move on to part 2. I'll introduce 7 unexpected signs of heart failure that show up in the body. Heart failure is a condition where the heart's pumping function becomes weak. When the pump becomes weak, blood can't be delivered to every part of the body. Furthermore, the blood that can't be pumped out starts to back up, causing fluid to accumulate in various parts of the body. Think of it like a broken drain pipe, with the heart acting as the pump. The water pressure drops, making it harder for water to come out of the faucet, while at the same time, water starts leaking from the pipes along the way, causing flooding in various places. The symptoms change completely depending on where this flooding occurs. I'll start announcing from number 7, the 7th SOS sign from the heart, feeling foggy or spaced out. Lately, you might feel like your head is foggy, you can't concentrate, or your forgetfulness has gotten worse. Normally, people think, is it because of age? Or is this the start of dementia? Many people feel this way. However, sometimes the cause is actually in the heart. When you develop heart failure, the pumping function of the heart weakens. As a result, the amount of blood reaching the brain decreases. The brain is the organ that uses the most oxygen in the human body. Even though the brain is only about 2% of your body weight, it consumes 20% of the oxygen. If the blood flow to the brain decreases, it's like a computer running on low power. The screen might lag or freeze. That's what's really happening when you feel spaced out or can't concentrate. Your head feels foggy, but you don't know the cause. For people like that, getting your heart checked is one option. Number 6 is snoring. Lately, my family often tells me that my snoring has gotten worse. Even when I wake up in the morning, I don't feel refreshed at all. Actually, this could be a sign of hidden heart failure. According to a statement from the American Heart Association, 40 to 80% of heart failure patients have sleep apnea. In other words, some people stop breathing while they're asleep. Isn't this number surprising? It's more than half. Here's how it works. With heart failure, your legs swell during the day. This means that fluid builds up in your legs. Then, when you lie down at night, that fluid moves from your legs to your upper body. Fluid also accumulates around your throat, making your airway narrower. That's why your snoring gets worse and sleep apnea occurs. In other words, swollen legs and snoring have the same cause. Sometimes, this happens because the pumping function of the heart has decreased. Some of you might think snoring is an ENT problem, right? That's certainly true in some cases, but if you also have swelling in your legs, please consider your heart as well. Number 5. Loss of appetite. Your stomach feels bloated. You feel nauseous. You'd usually assume these symptoms are linked to your stomach or intestines, right? But even after a gastroscopy or colonoscopy, nothing is detected. Actually, these are typical symptoms of what's called right-sided heart failure, a type of heart failure. When you develop right-sided heart failure, blood starts to back up as it returns from the body to the heart. That backup affects the liver and intestines. Blood congestion in the liver causes it to swell. When congestion occurs in the intestines, the blood vessels there become swollen. This makes it difficult to absorb nutrients, causing bloating. You may experience indigestion, nausea, or even lose your appetite. It's like a clogged drain pipe where the water in the sink can't flow properly. If water accumulates in the sink, you can't add any more fresh water, right? This is similar to how people lose their appetite. Even if your endoscopy shows nothing abnormal, you might still feel stomach discomfort. In that case, consider a heart check. Number 4, shortness of breath when leaning forward. You feel short of breath when you lean forward to tie your shoelaces. You get out of breath when taking laundry out of the washing machine. Even just picking something up off the floor makes you gasp for air. This is called bendopnea in medical terms. The mechanism is simple. When you lean forward, your abdomen gets compressed, so the pressure increases. When that happens, the diaphragm is pushed up and the lungs get compressed. When that happens, the blood that had pulled in the legs suddenly rushes back to the lungs, but a weakened heart can't handle that sudden return of blood. So water starts to overflow into the lungs, which are the organs just before the heart in the blood flow. As a result, since water is overflowing into the lungs, which exchange oxygen and carbon dioxide, even a slight forward-bending movement can make it hard to breathe. Most people are concerned about shortness of breath when climbing stairs or slopes. However, I think many people don't notice or aren't aware of the shortness of breath that happens when you lean forward. Don't just think it's due to weight gain. If you get short of breath tying your shoes or doing similar tasks, consider heart failure as a possibility. Remember this. Number 3, waking up 2 or 3 times at night to go to the bathroom. Many people think this is due to prostate problems or a weak bladder. Of course, in many cases, it is a urological issue, but if you get tested at the urology department and nothing is wrong, in such cases, please also consider the possibility of a heart problem. The mechanism behind wanting to urinate at night due to heart failure is simple. For people with heart failure, when they are standing or sitting during the day, they can't circulate blood throughout the body efficiently, so because of gravity, swelling tends to occur in the legs. And because blood flow is reduced, kidney function also declines, so urine often isn't produced properly during the day. However, at night, when you lie down in bed, the effect of gravity disappears, and the fluid that had accumulated in your legs quickly returns to the heart. When that happens, the heart swells up and becomes full. Then, the heart releases a hormone called diuretic peptide, signaling that it can't handle anymore. It sends a command to produce more urine, so you end up making a lot of urine at night and have to get up to go to the bathroom. That's why sometimes waking up multiple times at night to go to the bathroom can actually be caused by the heart. By the way, swelling in the legs and waking up at night to go to the bathroom can actually be signs of both heart problems and kidney problems. In the past, I've made a video about signs of kidney problems, so if you're interested, please check out that video from the description later. Number 2, a cough that won't go away for weeks, wheezing, and it gets worse when you lie down at night. Normally, when you think of a cough, you think of a cold or asthma, and you go to a respiratory specialist to get asthma medicine, but it just doesn't get better. Actually, this could be cardiac asthma. It's not a term you hear very often, is it? Actually, it's said that it's pretty hard to tell the difference between regular asthma and wheezing caused by heart problems. Furthermore, if you're mistakenly diagnosed with regular asthma and treated with inhalers or other medications, depending on the type of medicine, it could actually make your heart symptoms worse. Let me explain the mechanism. When you have heart failure, fluid builds up in the lungs, which are the organs just before the heart, leading to a condition called pulmonary congestion. It's like the blood is backed up and congested in the lungs. As a result, swelling also occurs in the airways inside the lungs. This causes the bronchial tubes to become narrower and tighter, making the airways thinner, which leads to wheezing, whistling sounds, and shortness of breath. Even during a physical exam, it's hard to distinguish these sounds from asthma, but certain points can help differentiate them. Wheezing caused by heart problems, known as cardiac asthma, often gets worse at night when you lie down. That's because when you lie down at night, fluid from your legs moves to your lungs, making it easier for your lungs to become swollen. However, many people with asthma also experience worse symptoms at night, so just because your symptoms get worse at night doesn't necessarily mean it's cardiac asthma. If your cough or wheezing doesn't improve even after taking asthma medication, there might be a problem with your heart. The number one sign is that the veins in your neck become prominent. In medical terms, this is called jugular vein distension. There are 3 reasons why this is the number one sign. First, anyone can check it in front of a mirror. Second, various data have shown that jugular vein distension and swelling in the legs are effective indicators for accurately predicting the worsening of heart failure. And third, when you notice this sign, there's still a good chance it's not too late if you get treatment. Why do the veins in the neck swell? The mechanism is simple. The blood that is pumped from the heart to the brain returns through the veins in the neck, right? However, if the heart can't circulate blood properly, a traffic jam of blood occurs in the veins returning to the heart, causing the veins to become swollen and engorged. For people with a healthy heart, it's rare for the veins in the neck to swell or be visible from the outside when standing. But for people with heart failure, even when standing, the veins in the neck can bulge and be visible like in this image. The area where you can see them is along the side of the neck, from just below the ear down to the collarbone. If the veins are bulging or pulsating, that's an SOS from your heart. So in part 3, I'll explain in detail how to self-check for these signs. Up to this point, I've introduced that there are many signs of heart failure that don't seem related to the heart. Now, how exactly should you check, and when should you go to the hospital? From here, it's the practical part. I'll introduce 3 simple self-check methods. The first one is the neck blood vessels I just mentioned. It's easy to do. Stand in front of a mirror, then turn your neck slightly to the side. Look at the line from under your ear down to your collarbone. Check if the blood vessels are bulging or pulsating. For healthy people, they are hardly visible when standing. If you can clearly see them while standing, please visit a cardiology clinic. The second self-check is measuring your weight every day. This is a very simple but powerful method. When I see heart failure patients in the outpatient clinic, I always check their weight. When fluid accumulates in the body due to heart failure, your weight increases. If you gain more than 2 kilograms in 3 days, you should be careful. If possible, weigh yourself each morning under the same conditions. Right after you wake up, after going to the bathroom, and before eating breakfast. If you keep these conditions the same, you can accurately monitor changes in your weight and see if fluid is accumulating in your body. The third self-check is to check for swelling in your legs. Press firmly on the inside of your shin with your thumb for 10 seconds. If the indentation from your finger doesn't go away after you release it, this is called pitting edema. When heart failure occurs, the swelling also appears like this, where the indentation from your finger doesn't go away. If the marks from your socks don't go away easily, or your shoes feel tight in the evening, these are also signs of swelling in your feet. Lastly, let me mention the signs that mean you should go to the hospital immediately if you experience them. I've organized the signs into 3 levels. Level 1 means see a doctor within a week. Level 3 means go to the hospital immediately. Level 1, see a doctor within a week. Swelling in your legs lasts for 2 or 3 days. You get short of breath more easily than before. You suddenly need to use the bathroom more at night, and your weight has risen by over 2 kilograms in 3 days. Level 2, signs to see a doctor today. You can't sleep due to shortness of breath when lying down, have a persistent cough with wheezing, and both legs are suddenly very swollen. Level 3, signs that mean you should see a doctor immediately. You have trouble breathing even when resting. Chest pain or a feeling of pressure lasts for more than 15 minutes. You feel faint or confused. How was that? The main thing I want to share is that heart symptoms often don't appear as heart issues. Shoulder pain, coughing, even getting up to use the bathroom at night, all of these could be your heart asking for help. The only ones who can notice these signs are you and your family members beside you. I hope you'll share this video with your loved ones. Here's a summary of today's lesson. In the first period, I talked about pain from a heart attack that spreads to other areas. Pain in the left shoulder, left arm, jaw, teeth, back, or pit of the stomach could actually be an SOS signal from the heart. You should be especially careful if the pain appears when your body is under stress and goes away when you rest. In the second period, I talked about 7 unexpected signs of heart failure. 7th place, feeling mentally foggy. 6th place, snoring suddenly getting much worse. 5th place, loss of appetite and a bloated stomach. 4th place, feeling short of breath when leaning forward. 3rd place, waking up several times at night to go to the bathroom. 2nd place, a persistent cough. And 1st place, bulging veins in the neck. In the third period, I explained how to do a self-check and when to see a doctor. You can start today by checking your neck veins, weighing yourself daily, and looking for leg swelling. And finally, if listening to today's lesson made you want to try a self-check, or if you've had symptoms like these in the past or received similar treatments, please share your experiences in the comment section. I think it will be helpful for others as well. And if you like this video, please hit the like button, or even the dislike button is fine. Your feedback will help us improve next time. I'd really appreciate it if you could subscribe to the channel before you forget which one it is. Well then, see you in the next video. Goodbye. As a general practitioner, I've learned from my patients how to age well after 70, and I want to do the same. I never realized life could be like this. These stories share lessons I've learned from many patients. Chatting with friends is more important than exercise, and when it comes to medicine, less is often better than more. This is packed with wisdom older people have shared with me about how to stay healthy and happy at any age. Please check it out from the description below.